We do a lot of treatments for people with cystic fibrosis. Sometimes they need nebulized breathing treatments to help hydrate and move the mucus around in their lungs. Probably about 85% of people with cystic fibrosis have a blockage of pancreatic enzymes that do not allow them to digest their fat calories. And so if you can imagine a fat calorie or a gram of carbohydrate is 4 calories, a gram of fat is 9 calories. So if they're not absorbing, 2 times the amount of their calories, you can see that they wouldn't be very successful at growth. Antibiotics, unfortunately, people get bacteria that do require frequent surveillance and frequent antibiotics, but it's never anything we do without knowledge going forward. The reason we're very limited in what we do with antibiotics is we want to make sure that we don't develop resistant infections. A lot of times people take antibiotics unnecessarily, and we only treat people with antibiotics when we have a roadmap to tell us what bacteria need to be treated. Chest physical therapy is something that every family has to do every day, and we believe that it's a very integral part of a baby starting out. If a baby understands and knows that it's part of their routine that they're going to have clapping on their chests or vibrations in their chest, they become more successful at adapting that throughout their whole childhood. It's not unusual for someone to have CPT or a VEST therapy treatment for 20 minutes at least twice a day, and during illness multiple times per day beyond that. It would not be unusual for an infant with cystic fibrosis to have enzyme replacement in actual capsule form from the time they're diagnosed before every single feeding. It's not unusual for an infant to need salt throughout the day. It's not unusual for someone to need 2 to 4 breathing treatments per day and have clapping on their chest at least twice a day. And these are the standards that we know evidence shows us will make them have successful lives going forward. I do think that in our lifetime, we're going to see big changes with cystic fibrosis. Within the past few years, a new medication came out that actually changed the entire defect of cystic fibrosis, allowing the sodium and chloride to move through cells correctly. It's only a treatment available for about 3% of people with cystic fibrosis, but it's been a very effective treatment. I think that in the short term, I believe that we're going to see these lock-in key medications come available for every genetic modifier for cystic fibrosis to change the basic defect, and I look forward to that day. A lot of times when I see an infant in the clinic with cystic fibrosis and I'm telling them a family that their baby has this illness, it's hard to say, but I really want to make sure that people understand that I have every intention that that baby is going to grow up to be a successful adult and that they can have a healthy life if they help their child adapt the therapies that need to be done so that they'll grow and develop well.